Now, the Osun State in the southwest of Nigeria is one of the earliest locations in Nigeria that recorded COVID-19 infections and subsequently thrived, owing largely to what many experts have blamed unavoidable mismanagement of the situation. But the state government says it has gotten a hold on that situation, and now it's also working hard to prevent a community spread of the coronavirus in the state. So to get more of what the Osun State government is doing in that respect and in the respect of COVID-19 in general, we're now being joined by Funke Egbemode, Osun State Commissioner for Information. Welcome to the program, ma'am. Good morning.
Good morning.
Good morning. Thanks for having me.
Good morning. Good to have you join us on the morning show. Well, I mean, Osun State is number 4 on the COVID-19 list with 20 cases, coming after Kano, which has 21. And then, of course, on the top of that list is Lagos State, followed by the FCT. Now, the Osun State Governor Yetola, has had to impose a lockdown on the state, and I think he has renewed it. But what is the level of cooperation that you are getting from the people? Because it was in Osun State that we heard recently that 6 persons escaped from the isolation center, and then later the state government insisted that it was only 1 person that escaped from the isolation center, and he had to be hunted down and returned to that isolation center. Is government getting the cooperation of the people in terms of staying at home and observing the various protocols in terms of social distancing and the lockdown?
Thank you very much, Doc. It's been a really tough time, because when you tell people who are generally very active people to sit at home, it's like declaring a non-stop curfew. But largely, we have enjoyed the cooperation of the people, and that is why we have been able to make appreciable progress. I would say we've had more than 90% cooperation from the people is staying at home. But there are still a few people who are cynical, a few people who we have to keep explaining to that it's just for a bit. It's just a sacrifice that we need to make. And that's what the government keeps emphasizing. And that's the kind of saying and jingles that we keep pushing out, that people cooperate. It's like a 9-month pregnancy. It has an end. There's an end in sight. And considering the kind of progress we've made, although NCDC statistics has to remain the way it is, that we had recorded 20 cases, I can happily say that in the first 14 days of lockdown, what we made was progress. We did not record a fresh case while within the state, apart from those that were in isolation. We have been able to discharge the bulk of that 20. So all we are asking for now is more cooperation so that we can get 100% cooperation.
Thank you for your clarification on that, ma'am. Now, you said that you did not record a fresh case after the lockdown. So I wanted to ask you, how many people are being tested a day? What is the testing capacity that is happening in Osun State?
We are lucky that we have one of the recognized testing centers located on the premises of Redeemers University in Ede, which is just about 10 minutes drive from the state capital. And so we have capacity. We are very close to the point of test, and we get our results as quickly as they can manage, because they are also attending to other states. We keep testing. We keep our call center open. We have an emergency call center. For now, like Dr. Chikwe said, what we have is a lot of worried wells, and people making attempts to get in touch with the state. And the call center is 24 hours. The workers there do shift, so we can be reached anytime. So testing keeps going on. And as soon as we get response, we are doing contact tracing. And so I would say largely that we are in a good place right now.
Well, the governor Oyetola, the other day said that Osun State's case is peculiar. I guess the case of Osun State is peculiar in many ways. But let's look at one regard. Many of the cases reported in Osun State are imported. Osun State had just about 6 cases, the index case plus 5, then the index case was discharged. But then there was this truck bringing people from Abidjan, which had passed through Osun State. Osun State did not want that truck to stay in its territory. But Osun State accepted those persons, over 100 of them, on the grounds that the people claimed that they were natives of Ejigbo. When you look back now, do you think that it was a good idea to have allowed those returnees from Côte d'Ivoire to come straight to Osun State at a time when even the national coordinator of the Presidential Task Force on COVID-19 is saying that interstate travel should be discouraged? Do you think that that was an unwise choice on the part of your government, allowing people from Côte d'Ivoire to come and stay in Osun? And then most of the cases that the state now recorded came from that group.
At first, everybody in the state panicked. But, you know, when you have a leader who can see beyond the present point, he was the governor was contacted by Governor Abiodun of Osun State, who told us that there is this group of people who said that they are all from Ejigbo, and they were already in Nigeria. If the governor of Osun had said, okay, they should turn them back, as we later discovered when we isolated and profiled them, they are from different parts of the Southwest. They are from different parts of the entire South. We had people from the East. We had people from Ekiti. We had people from Delta. We had people from Imo. And so you imagine if we had just allowed them to disembark in Ibadan, to disembark in Lagos. When we finished profiling, there were 2 who went back to Lagos. And if they had all tested positive, you can imagine the kind of figures we will be talking about in the country now. So we are grateful that we have a man who could act even when those around him and those in the state were in a panic. It allowed us to isolate all those people and protect the nation from what would have been an escalation of community transmission. So when we isolated them, we had to test all of them. We took samples from all of them, moved them into a 130 isolation center, a newly renovated hospital in Ejigbo, and separated the negative when the test came from the positive, and then arranged for those from the different states to go, and kept the ones that are positive and took care of them, 10 of whom have been discharged. So I'll say that, of course, at face value, at first response, everybody panicked, but the governor stood his ground and said, if we let them, if we say that, oh, they are not ours, or they should go back, chances that they will filter into different parts of the country and cause more distress was there. So we thank Governor Abiodun of Osun State for providing security to shepherd those people to Osun, to the designated point, because without what he did, we would have lost some of them on route to Osun. And now we're all fine. They're all fine. They were all unhappy at first that We quarantined them. We did not allow them to join their families. But at the end of the day, they saw the reason, they saw the sense, they saw the good motive of the governor and the states in keeping them where we kept them. Most of them have joined their families now.
Okay,
We discharged them.
Sorry to cut you short. We need to take a short break, a commercial break. When we return, the conversation will continue. Please stay with us.
Welcome back to the morning show. Here on Arise News, Mrs. Funke Egbemode, the Osun State Commissioner for Information, is still with us on the program. Ma'am, thank you for staying with us and joining in on this conversation. Now, I'd like us to move on to talk about social interventions currently going on within the state with regards to cushioning the effects of COVID-19 on the people. I understand that 25,907 vulnerable citizens are currently receiving palliative measures from the government. Do you want to shed more light on that and how the current initiatives are going and what other social interventions are being carried out to cushion these effects?
Thank you. We already planned right ahead to ensure that the sit at home, that the lockdown goes as smoothly, is as easy on our people as possible. So it's work in progress. We are attending to those 25,000 and distributing. There's a cash transfer, and then we're also distributing other relief items. Don't forget that the government set up a 21-man committee chaired by Pastor Adeboye, who bailed the cat by also giving us the relief cash, and we have continued to receive relief items in bids, some huge, in our storehouses, and that's what we're distributing. And we continue to do that. The government also is taking in that there are members of the state, there are citizens of the state who continue to pitch in, and there are the relief committee, which consists of people who are well-to-do, people who have great spirit of giving in the state are there, and is going to continue to get to the state, get to different people at different levels. And we continue to do our best to ensure that the people that can go out, especially those who earn their living on a daily basis, get some kind of relief as often as possible from the government.
Well, earlier on, I said that Governor Oyetola, in one of his public statements, said that the situation in Osun is peculiar. And he went further to appeal to the federal government of Nigeria to support Osun State to be able to deal with this COVID-19. And indeed, Osun State is peculiar. It's not like Lagos. It's not as if you have, local or international airports. It's essentially a civil service state, and then with a history of unpaid salaries. Now, has there been any response from the federal government by way of special assistance for Osun State?
That's work in progress. It's something that we are expecting to happen any moment now. We have not. I'm not aware that we have received anything huge, but I know that the federal government knows that we need assistance to get through this rough patch, and I'm sure that we'll report what it is, whether to the vulnerable. And that's what we are working with now. Until we get something massive to assist us, yes, we are doing well. We expect the federal government to assist us, considering that this governor responded in a way that saved the nation from a catastrophic distress. If all those people that we kept here had gone in their different ways, we will have more problem on our hands than we do right now. And let me quickly point out that this state has moved from the committee of states that don't pay salaries. We're not owing anybody as at now. This very moment, Governor Oyetola has paid salaries to this very moment. We are not owing anybody. We have a state that pays salaries at the end of every month.
Well, that's good news, and that's the way government should be. Now, ma'am, let's speak about a statement that you put out yesterday on the non-adherence of private hospitals treating COVID-19 patients. This is also something that has been covering our national newspapers, and it's been the talk of the country, if I can put it in that way. Now, have there been any suspected cases within the state whereby you have suspected that private hospitals are treating COVID-19 patients? And how can or how is the Osun State government trying to call for or is calling for better collaboration with private hospitals in order for us to avoid that particular situation?
Thank you. The statement yesterday was to ensure that it doesn't happen here. We know it has happened elsewhere, and we don't want it here at all, because that will negate every good thing that we have been able to achieve. So we're working with the Nigerian Medical Association here to ensure that their members continue to cooperate. They have done so marvelous. The statement yesterday was was being proactive, so that no doctor in a private hospital gets tempted to take on any patient that they don't understand their symptoms. They are trained, they are professionals, but our government facilities are equipped with the right personnel and the right equipment so to take care of COVID-19 suspected cases. So far, God has been kind to us. We are doing well. And so we pushed out that statement to ensure that what happened elsewhere does not happen here. We do not have any private hospitals stepping out of line, and we want it to remain so.
Well, there's the case of a young man in Osun State who was said to have criticized the state government on Facebook. He allegedly said Osun State was quoting big numbers so that the state government could collect money from the federal government. And he has since been charged to court. What's the situation with that case? Is this an isolated case, or Osun State is monitoring Facebook closely, and anybody that criticizes government will quickly be arrested and charged to court? Is that the situation? And where are we with the case involving Said?
No. It's not that we are saying people should not criticize the government. We also need the criticism to ensure that the criticism keeps us on our toes. It helps us to feel the pulse of the people. But the case of Said is in court. I'm just a journalist. I cannot comment. It would be wrong for me to comment on what is already in court. But criticism is what keeps us going. It's what keeps us working hard. We are not saying people can't criticize us, but I can't comment on the case of Said because it's already a case in court.
Okay, ma'am. And I'd also like to ask you about business returning back to usual in Osun State. When do you see this happening? Do you see another extension on the lockdown within the state? Briefly, ma'am, because we only have a few seconds, sorry, what do you see the situation playing out to be?
Right now, the governor and the government is concerned about keeping everybody safe and alive. When we are sure that we're all safe to continue our businesses, I'm sure the lockdown will be relaxed. But you see, even when we are discharging patients and we have just a few left in our isolation centers, we have to consider what is going on in our neighboring states. We will continue to keep our borders locked so that our people are safe. Until we are sure that we are completely safe, we'll continue to stay in our safe zone.
Well, on that note,
right now, it's about safety.
On that note, thank you very much, ma'am, for joining us on this conversation and giving us a greater insight into Osun State and what is currently going on.